Hello and welcome. You have reached the rapid response video. I would recommend that you please take notes during this informational video so that way you can refer to them when you participate in the case study with Mrs. Aho in the Google Drive. No worries, I will provide that link to the Google Drive at the end of this video. Now for the case study. In report from the emergency room nurse, you were informed your patient is female and 68 years old. She arrived to the emergency room 4 hours ago, and she has a diagnosis of dehydration and pneumonia. She was having a lot of shortness of breath at home, and that's what brought her to the hospital. She has a past medical history of coronary artery disease and hypertension, but she hasn't really had any problems with breathing in the past. When the patient arrives to the unit, you perform your assessment. The patient is laying in the bed. She's on her oxygen at 3 liters and is saturating 94%. She's unlabored, and she has diminished lung sounds in the left lower lobe when you auscultate posteriorly. Her heart rate is regular and in the 90s, and when you take her blood pressure, it's 146/80. She does have a peripheral IV in her left arm. It looks fine, and the IV fluid is infusing via the IV pump with normal saline at 50 mL an hour. She also received her IV antibiotic in the emergency room, so you don't have to worry about that. And right now, you're just waiting for her medications to be profiled in the computer system so that way you can give her her blood pressure meds that she typically takes at home on a normal basis. It is now 11 in the morning, and you notice your CNA is calling for you, and the emergency call light is going off in your patient's room. So you go in there immediately. The CNA explains that the patient had to go to the bathroom and she assisted her up, and the patient passed out for several seconds. The CNA is now propping her up against the wall in the bathroom, and the patient is now dyspneic and very weak. What are you going to do next? I need you to click on the link to the Google Drive and participate in this case study now. Good luck, and see you in a few minutes.